Now, I'm a neuroscientist by training, and I know a little bit about how the brain performs under stress. It releases cortisol, that raises your heart rate, it modulates adrenaline levels, and it clouds your thinking. And there's perhaps no more stressful a situation than when you're confronted with a medical decision to make. And at some point, all of us are going to be in that position where we have to make a very important decision about the future of our medical care or that of a loved one to help them with the decision. So, suppose you go to your doctor and the doctor says, I just got your lab work back, your cholesterol is a little high. Now, you all know that high cholesterol is associated with an increased risk of cardiovascular disease, heart attack, stroke. And so you're thinking having high cholesterol isn't the best thing. And so the doctor says, I'd like to give you a drug that'll help you lower your cholesterol, a statin. And you've probably heard of statins. You know that they're among the most widely prescribed drugs in the world today. You probably even know people who take them. And so you're thinking, yeah, give me the statin. But you should ask at this point for another statistic, and that is, tell me about the side effects, right? So for this particular drug, the side effects occur in 5% of the patients. And they include terrible things: debilitating muscle and joint pain, gastrointestinal distress. But now you're thinking, well, 5%, not very likely it's going to happen to me, I'll still take the drug. But wait a minute. Remember, under stress, we're not thinking clearly, so think about how you're going to work through this ahead of time so you don't have to manufacture the chain of reasoning on the spot. 300 people take the drug, right? One person's helped. 5% of those 300 have side effects. That's 15 people. You're 15 times more likely to be harmed by the drug than you are to be helped by the drug. Now, you might be thinking I've pulled this number out of the air for shock value. But in fact, it's rather typical, this number needed to treat. For the most widely performed surgery on men over the age of 50, removal of the prostate for cancer, the number needed to treat is 49. That's right, 49 surgeries are done for every one person who's helped. And the side effects in that case occur in 50% of the patients. They include impotence, erectile dysfunction, urinary incontinence, rectal tearing, fecal incontinence, and if you're lucky, and you're one of the 50% who has these, they'll only last for a year or two. So the idea of the pre-mortem is to think ahead of time to the questions that you might be able to ask that will push the conversation forward. You don't want to have to manufacture all of this on the spot. And you also want to think about things like quality of life, because you have a choice oftentimes. Do I want a shorter life that's pain-free, or a longer life that might have a great deal of pain towards the end? These are things to talk about and think about now with your family and your loved ones. You might change your mind in the heat of the moment, but at least you're practiced with this kind of thinking. Remember, our brain, under stress, releases cortisol. And one of the things that happens at that moment is a whole bunch of systems shut down. There's an evolutionary reason for this. Face to face with a predator, you don't need your digestive system or your libido or your immune system, because if your body is expending metabolism on those things and you don't react quickly, you might become the lion's lunch, and then none of those things matter. Unfortunately, one of the things that goes out the window during those times of stress is rational, logical thinking, as Danny Kahneman and his colleagues have shown. So we need to train ourselves to think ahead to these kinds of situations. I think the important point here is recognizing that all of us are flawed. We all are going to fail now and then. The idea is to think ahead to what those failures might be, to put systems in place that will help minimize the damage or to prevent the bad things from happening in the first place.